Researchers at the Conference on Retroviruses and Opportunistic Infections 2024 presented findings indicating that the use of the antibiotic doxycycline following sexual activity has contributed to a decrease in sexually transmitted infections in San Francisco. I am Dr. Kayode, and you are watching Zoom Hospital Channel. In October 2022, San Francisco became the first city to recommend post-exposure prophylaxis with doxycycline, known as Doxycycline Post Exposure Prophylaxis (Doxypep), initially for gay and bisexual men and transgender individuals. Over the following year, there was a significant decline in chlamydia cases and a decrease in syphilis infections, although gonorrhea rates remained relatively stable. These findings align with recent clinical trials, suggesting that doxycycline post-exposure prophylaxis is both sought after and effective in reducing sexually transmitted infections incidence. Note that we don't intend to advertise or promote any drug, but to advance standard scientific information. Doxycycline post-exposure prophylaxis involves taking a single 200 mg dose of doxycycline within 72 hours after sexual activity. Previous clinical trials, such as the IPERGAY pre-exposure prophylaxis PrEP trial in 2017, demonstrated a reduction in the risk of chlamydia and syphilis infections among gay and bisexual men by about 70%, with less significant effects on gonorrhea. Subsequent analysis of this trial revealed even greater risk reduction percentages for chlamydia and syphilis, 86% and 79%, respectively, though gonorrhea reduction was at 33%. Further studies in 2022 showed that HIV-positive individuals who took doxycycline after sex experienced substantial reductions in chlamydia, syphilis, and gonorrhea infections compared to standard care. Similar reductions were observed among HIV-negative individuals on pre-exposure prophylaxis. Recent data presented at Conference on Retroviruses and Opportunistic Infections highlighted that the risk reduction for sexually transmitted infections remained consistent among participants who initially received doxycycline, even in an open-label extension of the trial. Remarkably, individuals who were initially in the standard care group but later offered doxycycline post-exposure prophylaxis experienced a sharp decline in sexually transmitted infections incidence, despite an increase in the number of sexual partners and condomless sex acts. Interestingly, the U.S. Centers for Disease Control and Prevention (CDC) released national guidelines for doxycycline post-exposure prophylaxis in October. The San Francisco Department of Public Health had already issued recommendations a year prior, extending eligibility beyond CDC guidelines to include transgender men and non-binary individuals, as well as those with multiple sexual partners regardless of recent STI infection. Kindly consult your doctor to know if you qualify for this. Despite concerns about widespread adoption, such as potential antimicrobial resistance, the proactive distribution of doxycycline post-exposure prophylaxis represents a potent strategy for STI prevention within communities. Warning: this is not protective against viral STI like HIV, hepatitis B, and the likes. Make sure you consult your doctor before starting this post-exposure prophylaxis. Kindly subscribe to our channel and hit the notification bell so that you can be notified anytime we release a new video with a life-saving medical innovation. You can contact us via the link in the description below for any medical inquiry.